Welcome, everyone. My name is Susan Edgman-Levitan, and I'm the Executive Director of the Stokel Center for Primary Care Innovation in the Division of General Internal Medicine, and work very closely with Dr. Russell, Dr. Triant, and everyone else that you see on the call to help plan and put together these town halls. So we're very excited to have you here today and looking forward to a good discussion. Before we get started, I just want to go over a few housekeeping rules. So the first thing is that if you are interested, you can keep your camera off if that's your preference. And you can also change your name by right-clicking your mouse over your name, and you might just want to use your first name or whatever. It's up to you. We are recording the session, but with the recordings, only the speakers are visible. We never show any patients in any of the town halls that we record because that would be a privacy issue. We've muted everybody for now to eliminate background noise, but because we don't have a huge group, when we get to the discussion part of our presentation today, we're going to unmute people so we can all talk. If you want to view just the speaker, if you go up to the top right-hand corner of your screen where it says view, you can set it up so that you just see whoever's speaking, or you can set it up for a gallery view where you see everyone. If your screen becomes jumpy, it often helps to turn your camera off, and that will increase the bandwidth for your internet and make the presentation easier to see. For questions, we ask you to use the chat feature that's right in the center down at the bottom banner of the screen. And I just want to remind you that anything you put in the chat can be seen by everyone. So you do not want to share any personal or private medical information. But we do want you to ask questions or, suggest ideas or whatever in that chat function. So with that, we're going to get started. And I am going to now introduce our speakers. Today, we have Dr. Matt Russell and Dr. Jeannie Triant, who are going to be presenting. Dr. Triant is a physician and clinical investigator in the Division of Infectious Disease and General Internal Medicine at Mass General, and she's dedicated to studying the aging-related complications of HIV infection. Her research focuses on the intersection between HIV and non-communicable chronic disease complications, and her team is currently investigating optimal cardiovascular risk prediction strategies in HIV/HCV co-infected individuals. Dr. Triant is an active infectious disease clinician, maintaining an outpatient clinic and attending on the inpatient infectious disease consult service at Mass General. She also co-directs the Age Positively program at Mass General that this is part of, and serves on the HIV Massachusetts Board of Directors. Through her research in clinical care, she brings a cross-disciplinary approach to issues related to HIV and aging with the goal of improving long-term outcomes and enhancing care for people living with HIV. Dr. Matt Russell is the Clinical Director of Geriatric Medicine and Medical Director of the Ambulatory Geriatric Medicine Initiatives. In these roles, he has helped to expand the presence of geriatric medicine in both the inpatient and outpatient settings. Dr. Russell is board certified in internal medicine, geriatric medicine, and hospice palliative care medicine, and has practiced across the spectrum of healthcare delivery in both fields, including home and office-based practices, skilled nursing facilities, and acute hospital care. He has held leadership positions, including medical directorships of several nursing and rehabilitation facilities, a home health agency, and a hospice program. As a faculty member of the Academy for Communication in Healthcare, he is a local and national resource for teaching learners of all levels in the practice of high-stakes communication in the clinical setting. So with that, we're going to get started. Dr. Russell is going to kick us off. today. So welcome again. And Dr. Russell, let's get going.
Thank you so much. First of all, just a very hearty, warm welcome to all of you for coming to this afternoon. It's a beautiful, slightly cool spring day, but I appreciate you taking part of your afternoon to join this is our inaugural, and I hope the first of many town halls focused on our Age Positively program, which, is really about helping people thrive into aging, and with a specific focus of people with HIV and what their experience can be and how we can improve upon it. And now, just as a little disclaimer, I started medical school before ART came out, and I vividly remember the celebrations around the times when we had therapy to change this disease from such a horrible, life-limiting one to a chronic illness. And we celebrated so much at that time. And there's a sort of part, though, that we didn't prepare for when people age into geriatric land. And so we're going to talk a little bit about that today. But before we do, I just want to talk to you about what we're hoping to achieve with our town hall program. We want to provide expert medical information on topics important to you. I'll say a little bit more about that in the last objective. But we also want to alert you to any of our services, programming, research, and other clinical opportunities to help advance the cause of aging well for people with HIV. Lastly, we want to create a community. We want to speak to people about the things that they want to know about. And so this is going to be, oops, what happened? I've been hijacked. We want to solicit and present topics that are relevant and important to you. And so that will mean we'll need to come together and think about ways that we can do this, what will be important, and then what else do we want to do by creating this community? How does a geriatrician become involved in HIV care? Well, it's basically a matter of statistics. I, as a geriatrician, had infrequent encounters for people with HIV because I worked mainly in the post-acute setting in nursing homes. But the demographics are that most people with HIV in the United States are age 50 and over. And by 2030, that's going to go up to 70%. And we know that life expectancy has improved considerably in people with HIV. And so they're experiencing the onset of some geriatric syndromes, which I'll define in a second, as their HIV care continues to be optimal. And so helping people navigate this sort of what I call the space in between their infectious disease management and their geriatric care management is what we hope to do with our clinical programming. So a geriatric syndrome is pretty self-explanatory. It's what happens when the body can sometimes have decreased reserve, decreased resilience. And people, as they age, can develop things like cognitive impairment. You may have heard of dementia. They may have trouble with walking or with their vision or hearing. They may become frail. And we've done some research over the years to look and see how often this occurs in people living with HIV. And what we've come to find is that not only chronic conditions, but also geriatric syndromes do occur in patients living with HIV, and they seem to occur at an earlier age than in folks without HIV. And so that means that someone might be in their 50s and seeing a geriatrician saying, why am I seeing a geriatrician? That's a branding problem on my specialty's part. And we do need to improve this so that we are accessible. So what is a geriatrics model of care? So you think about if you have a pneumonia, you go see your primary care doctor, he's treating the pneumonia, giving you an antibiotic, and sending you on the way. We're looking at you in domains as geriatricians. We want to look at your physical function, what we call mobility. How are you doing for yourself in your home? What are you struggling with? What could be easier to make living at home safer, easier, etc.? We want to help with any cognitive issues or any mental health issues. How is your mind doing to keep that active and engaged, and also minimizing the impairments of things like nutritional deficiencies? We look at your medication. Medication management as folks get older is pretty critical because a lot of us are seeing different specialists, and sometimes the nature of healthcare in the United States is that the left hand may not always know what the right hand is doing. The evolution of the electronic health record helps reduce that, but sometimes, like in a city like Boston, you might have a lung doctor at Leahy, you might have a kidney doctor at Joslin, and you might have your HIV doctor at Mass General. And we always want to make sure as geriatricians that we're doing a thorough medication review to look for things like, one, are you on just too many medicines? Are there interactions of those medicines with one another? And we know that a lot of the negative interactions of medicines, they're not coming from the HIV meds. Those are not the ones, but the other non-HIV meds can become problematic and sometimes interact negatively with the HIV meds. But then above all, and this is especially important in geriatrics, we have to talk about what matters most. What I want for myself at 45 versus when I'm 85, they're very different things, and I will have very different priorities. For me, the issue may not be that my blood pressure is 120/80. It may be that I don't take a meal full of pills. And I need to know that the person that's taking care of me understands how I'm looking at those priorities. But this isn't really enough. And what we found is, as we've looked at the care of the older person with HIV, in addition to the 4 M's of mind, mobility, medication, and matters most, we also have to spread out a little bit in our understanding of the factors that go into keeping someone healthy and living in the community. So certainly HIV management, but also loneliness, isolation. How do we deal with issues of decreased socialization, stigma associated with age, with HIV status? All of these things can go into really impacting our health one way or the other. And food insecurity and housing insecurity are unfortunate realities for a lot of people as they age, and in people as they age with HIV. So I just wanted to provide that brief overview of why a geriatrician is getting involved in this area, and thank you for your attention. And now I'll pass on to Dr. Triant.
Great. Well, thank you. Thank you so much. I'm going to share my screen. So I have a few background slides as well to pull up here. All right. Well, welcome everyone. I'm so glad to be here and to see so many people here. And we're grateful to you for taking the time to come and attend today and join us in this inaugural Age Positively Town Hall. So a lot of what I say will echo what Dr. Russell said, but I'm going to give a little of an overview from the HIV perspective of why we think that this issue is so important and why we're so excited about this program. As Dr. Russell mentioned, people living with HIV are aging, and that's something that's really positive. As people are living long, healthy lives on antiretroviral therapy, and these might even be some old figures, but it's currently more than half of people who are living with HIV in the United States are 50 years and older, and this is only projected to increase over time. So that the majority of people living with HIV, and the vast majority, will be over 50 years of age. And as we start to get older, we start to think about ways that we can stay as healthy as we possibly can and ways that we can prevent either problems or prevent disease. And one of the things we want to focus on is how we can think about that, and how we can think about how living with HIV might impact our staying healthy well into the older decades. As people here know, starting and staying on HIV medications is one of the most important ways to stay healthy as someone living with HIV gets older, and staying engaged with your doctor and with medical care. But in addition to the HIV itself, which most people are doing really well with, it's important to think about other ways that we can stay as healthy as possible, and a great opportunity to think about prevention and how we can prevent disease or illness before it even starts. So this is a slide that Dr. Russell showed, and he talked about the many different elements of aging. And for this section of the town hall, I just wanted to focus a little bit on the comorbidities section. So this is chronic diseases or illnesses that tend to occur in older people. And these can include heart disease, they can include bone disease or fractures, they can include cancer, many different diseases that we want to look at and think about through the lens of living with HIV, and think about what might be different in terms of how we can really optimize our health and make it the very best for these illnesses. So we'll focus here on the chronic diseases, which are a little bit different from the geriatric syndromes, which Dr. Russell mentioned. So this is looking at rates of general chronic diseases. So again, diseases that people tend to get more as they age over time. And what this shows is what Dr. Russell mentioned, that for many diseases such as heart disease, people who are living with HIV tend to get these illnesses more frequently, and also tend to get them at a younger age, younger than might be expected. And some people call this accelerated aging. There are a lot of different ways to think about it. But I think the important thing is this tells us that we should be thinking about how to prevent disease and manage risk factors for disease even earlier if we're living with HIV. So I wanted to briefly touch on heart disease. This to be an area of interest for me, but it's also an area that in the past year we've seen a lot of focus on, and have actually seen some really exciting advances in thinking about how to prevent disease, specifically for people who are living with HIV. For heart disease specifically, a lot of different studies have shown that people living with HIV tend to get heart disease, including heart attacks or strokes, with more frequency than if they weren't living with HIV, even if they're on antiretroviral medications and the HIV is well controlled. And as I mentioned, we also tend to see heart disease coming up at younger ages in people living with HIV. And some of the risk factors or the causes of heart disease for people with HIV are the same as if they didn't have HIV. So we think about smoking, high blood pressure, high cholesterol, being less physically active. Those are all things that increase everyone's risk of heart disease. But in addition, for people who are living with HIV, we think that there are additional factors related to the HIV that might contribute. And that's why it's especially important to think early about preventing heart disease and keeping the heart healthy. Now, the really good news is over just the past year, there have been specific advances to help us prevent heart disease, and these have been specific to people who are living with HIV. So I'll briefly talk about them here, and I'm happy to discuss them more afterwards. But some people might be familiar. There was a large clinical trial that was conducted last year that looked at the use of statins in HIV. And statins are a class of medicines that reduce cholesterol. And this study looked at people with HIV who wouldn't normally need a statin. They were pretty low risk of developing heart disease. And what it found is that the statins actually helped to prevent heart disease, even in people who we didn't think were very high risk of developing it. And so this study was called the REPRIEVE trial. And what it actually led to just a couple of months ago was actually an update in the guidelines for HIV to recommend considering statin use for people living with HIV. And this is the first time that there's been a specific recommendation on how to prevent heart disease for people with HIV that's different than the sort of overall U.S. recommendations. And this basically what it said is that everyone living with HIV should consider being on a statin And for people with a higher predicted risk, the recommendation was even stronger. So what this did was change the recommended predicted risk from 7.5% to 5% and made this a strong recommendation. And so, for people here, this is certainly something that you could discuss with your doctor about the pros and cons. But it's something new. And a year ago, we didn't have these data or these recommendations to help prevent heart disease. And so, while there are new recommendations about statins and reducing cholesterol, there are many things that we can do to keep our heart healthy as we get older, and these apply to everyone. This is what's called Life's Essential 8, which was actually updated by the American Heart Association. It used to be the Simple 7, and now it's the Essential 8 because they added sleep. And this is ways to stay healthy as we get older. And it includes eating better, being more active, quitting smoking if someone's a smoker, getting healthy sleep, managing weight, controlling cholesterol, and managing both blood sugar to prevent diabetes, or if you have diabetes, and managing blood pressure. So these are all, also in certain elements, and a lot of these sort of can dovetail with Dr. Russell was discussing in terms of staying active and staying healthy, keeping both the mind and the body healthy and active as we age. So I wanted to let you know here, as we're getting older and as you are living with HIV, there are a lot of ways to stay healthy, and there's a lot of support to stay healthy as you age and get a little bit older. One way we hope is through this town hall program, where we hope to expand this and really have topics that we discuss topics here that are of interest and important to you. And that was one of our goals of this session, is to really hear from you what you would like to hear about in future town halls like this. And in addition to seeing your HIV doctor and your primary care doctor regularly, you can also see Dr. Russell, perhaps some people on this call already have, for really an amazing opportunity to think about all of these issues we've been talking about, how to prevent disease and how to age well and age in the most healthy way possible, and in a way that reflects your wishes and values, as you get a little bit older. So I would certainly recommend that. He's, a fantastic partner in this program. And so our program encompasses, as I said, clinical care, education, and as Dr. Russell also mentioned, we really hope to create a community around this, because I think there's a lot of, there are a lot of community and groups and advocacy around people living with HIV and also around older individuals. But in terms of community, those two don't come together as frequently as we would like. So we hope that this will be sort of a forum to really learn and to discuss and be with one another through this forum. And so I'll end by just making sure that everyone here is aware that National HIV and Aging Awareness Day is every year on September 18th. So we can look forward to that. And at this point, we'd really like to hear from you about what you would like to hear about at future town halls, and if there's anything that we talked about today that you'd like to hear more about. So thank you so much.
Thanks, Dr. Triant. So this is wonderful. I really appreciate you. That was really very important content about the ways that we know that we now can do research specifically for people with HIV, not just taking and extrapolating from other data sources. So this is very helpful to us clinically. So everyone should be able to unmute themselves at this point. And I guess what we're hoping to see is, if our goal is to present topics that are really important and not just things that we think are important, I think that the point is we want this to be relevant. We want this to be something that's actually resonates with what would be important to you. We do this programming in geriatrics as well, and our attendees have suggested phenomenal topics that we may not have thought of. If you want to look at our MGH Geriatrics Town Hall videos, we did a two-parter on sexual health, which was suggested by our patients, our attendees. And so things like that are 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 on the table. Sort of whatever you think you'd, hey, I need to know from the medical experts about this, this, and this. So with that, what questions do folks have, or what feedback do you have about our idea?
Well, people are thinking, I just want to also let everyone know that all of the town halls we've done are on the Mass General Hospital YouTube site. And so you might want to look at some of them because they've covered a very wide array of topics, such as supplements that work and supplements that are just a waste of money, appropriate uses of medical marijuana, cultural issues, poetry, readings, exercise, all sorts of things.
And can I just add to clarify? I think that's referring. So those are geriatric town halls or town halls for older individuals, but those did not focus on people who are getting older with HIV. And that's
right.
This is the first one that's geared to HIV specifically. And again, as Dr. Russell said, hopefully the first of many.
So I'd just like to thank everyone for coming today to our first of what we hope to be many more Age Positively town halls. Please feel free to send any suggestions or comments to our email address, and have a great rest of the day.
We're so grateful that you all could join us again, join us today, and we look forward to seeing you at future town halls. Thank you.